Hello. On behalf of the Moody College of Communication, I'd like to thank you for joining the first event of the Moody mini-series. In this time of physical distancing, Moody College believes now, more than ever, it's important to bring relevant topics via virtual platforms to our alumni and friends. You, as alumni, parents, friends, donors, and supporters, are the reason we've launched the Moody mini-series. We hope you find the topics over the next few weeks meaningful and educational. My name's Mike Mackert. I'm the director of the UT Center for Health Communication. I'm also faculty in the Stan Richards School of Advertising and Public Relations in the Moody College of Communication, and also Population Health at Dell Medical School. I think the last few months have really highlighted the importance of health communication. And so it's a real honor and exciting opportunity to share with you all today the work that our center has been doing for years and why we think it's particularly important kind of amidst the COVID-19 pandemic and maybe what it means after that. So today what I'm going to do is talk to you first about defining health communication in our work, just as a little bit of background for folks who aren't already familiar with us. Next, I'm going to talk about a hand hygiene promotion campaign that actually began life in an advertising master's class and then turned into a couple of research projects, and now is something that we're promoting as part of kind of contributing to public health amidst the pandemic. Third, I'm going to talk about what our center's been doing the last couple months as COVID-19 has really ramped up. And then toward the end here, we'll have some Q&A. People submitted questions before the talk today. And so I have a handful of first questions. If you also email this Moody College alumni at Austin, Texas, austin.utexas.edu address, they'll be monitoring that during the talk and send along questions that come up today. So the first thing is, as I go out and work with colleagues across a lot of different fields, people always kind of want to know what health communication is. People in more medicine tend, I think, first to think about patient-provider communication. People in public health often think more about, public service announcements and, the kind of ads you might see on TV. The way our center defines health communication is that it's both the science and the art of using communication to advance the health and well-being of people and populations. And the science piece is what I always highlight. A lot of colleagues in medicine and public health tend to think of communication as this soft skill. Either you're good at it or you're not. Maybe you had a really good mentor who taught you how to talk to patients if you're a provider. And our center is dedicated to the idea that there is a science to good health communication. I have a colleague who studies how you break bad news. And that is a thing that, there's a best way to do it, and she can train you in it and you can get better at it. And so we really want to highlight the fact that sort of there's an evidence base to good health communication work that's important to understand. There's also an art piece. I mean, I really appreciate kind of the art and the creativity involved in doing really good health communication. I think that's the advertising side of me and that part of my work. That's also really important. And then the people to populations piece is also important to understand. Like the College of Communication, we have people who do work at, in any way you can think about communication. And so in terms of health communication, that might mean things like provider-patient communication or developing big public service campaigns. But it also could be, understanding health on social media or, thinking about kind of any level at which communication can happen. We are thinking about health comm at those different levels. Our center thinks of its work in kind of three big areas, and part of that is contributing to that evidence base of health communication through research by faculty and students across UT Austin. We also think about education. So we have a minor for undergraduate students at UT. We have a portfolio for graduate students. And the picture you hear on screen is we run a summer Health Communication and Leadership Institute that for years has invited health comm professionals from around the country to join us in Austin in the summer. And so it's 3 great days with folks from the CDC, state health departments, nonprofits, and they come together to learn about health communication and leadership. This year, we're shifting to an online event, but it's one of my favorite weeks of the year and a really good opportunity to kind of spread the work we're doing here to a big audience across the country. And then we also practice health comm. The Center for Health Communication team includes 15 full-time staff. We also work with more than 50 faculty affiliates from across the university, graduate students and undergraduate students involved in our work, doing projects in partnership with the Texas Department of State Health Services, Health and Human Services Commission, UT System, MD Anderson Cancer Center. All these projects are really exciting because they help us contribute to the health of people, on the UT system campuses in Central Texas and across the state and beyond. And so it's a lot of exciting work that we get to do, which again is why I'm excited to share some with you today. I think as context, I also wanted to offer really quickly my own background. So my graduate work was actually studying telemedicine. And so I was doing work evaluating hospice care by video phone, and how do you remotely monitor patients with chronic conditions for the VA, and how do you build a website for maybe a lower health literate audience who perhaps can't read at all, and how do you develop an e-health intervention for them. And underlying a lot of that was this very education model where, well, we're going to tell you the 43rd time about diabetes, and this is the time you're going to change your behavior. And so when I had the chance to join the Department of Advertising, as it was called then, it wasn't yet the Stan Richards School, it was a really fortunate sort of accident in my career, because it was a chance to study advertising with great colleagues and teach advertising with some really, really bright students. And it helped me understand the importance of persuasion. And so one of the things that I looked at early on when I got to UT were DTC prescription drug ads. One of the common critiques of these kinds of ads is they use emotional appeals to sort of encourage a patient to go demand a particular prescription drug of their provider. And the critique there of using an emotional appeal is something that, in advertising, we teach, storytelling and emotion to sell everything from, dish soap to cars. And so this is sort of just the way I think good advertising works in a lot of ways. But if you think about that, a 30-second TV ad or maybe a print ad encourages a health conversation with a provider. That's really great in a lot of ways. And no one ever kind of critiques the Truth Initiative for using emotional appeals to help young people not start smoking. And so one of the things that I've spent time doing research on and thinking about and now practicing with the Center for Health Communication is, how do we take these tools and approaches that are so common and studied really well in the College of Communication and apply them in service of public health? And so the example I wanted to share with you is this hand hygiene campaign. When I'm teaching advertising students, every semester they do at least one health project. It's a chance for them to think about how the skills they're learning in advertising can be used not just to sell goods and services, but sell better health behaviors and help people make different health decisions they might want to make. And so every semester I do work with the really fantastic team at UHS, Healthy Horns. And one particular year, they kind of picked promoting hand hygiene on campus as the topic they wanted to work on. And I was excited. We'd never done that before. And, this is the moment where, the students did the project for 6 weeks. And they were doing things like, oh, if you wash your hands more, you're more likely to be healthy and get better grades. And after 5 or 6 weeks of doing work, the students presented to their client and the client was really happy. But I think the students felt like there was a little bit more they didn't get to, like they didn't fully nail it. And I took what they had built to my undergraduates, my advertising and PR management class. And I was showing them and getting their opinion on what my other students had created. And there was a young woman in the class, and she kind of raised her hand and she said, like, these are all fine, but what would make this really work is if there was a sign inside my bathroom stall when I'm in there that says, is the girl in the stall next to me going to wash her hands after she goes to the bathroom? And she said, that's really going to remind her of kind of that social judgment that we all feel if we see someone leave the restroom without washing their hands. And then she said, it's also going to make me really nervous that sign is in the stall next to me. And so I'm going to wash my hands really, really well afterwards. This is where, if we were in a big room together, I would ask everyone to raise their hand if you washed your hands the last time you went to the restroom. And invariably, all hands in the room go up because no one wants to admit in public they didn't wash their hands the last time they went to the restroom. And that's the idea that student was really tapping into, right? Like there's social judgment. There's a norm around hand hygiene after using the restroom. The actual number is something about 2 out of 5 people don't wash their hands after they use the restroom. This was, 5, 6, 7 years ago. And so our team took that idea and we wanted to build a research project and actually see if we could build a message around that idea that we could test. And so we got permission from the College of Communication actually to post signs in the CMA lobby and in the restrooms. And so I got to involve a team of undergraduate students and graduate students on this. And so first, the undergraduate creative students started just sketching out what might it look like to explain that 2 out of 5 people don't wash their hands after they go to the restroom. And so here you can see kind of a little sketch of 2 of the 5 students featured in this little potential poster ad. The little guy there has, looks like a urinal on his backpack, and someone's carrying kind of a toilet seat cover as their purse. And we liked the idea and a little bit of pre-testing. It seemed to be doing what we were looking for. And so we actually did a photo shoot at a local coffee shop. And these 5 students are the 5 who actually designed the campaign. And they kind of took the pictures and then edited them to make it look like, her laptop is now a toilet seat cover, to like really visually remind people and use that sort of disgust emotion to remind you of why you don't want to take the bathroom with you after you wash your hands. We also created signs much like that student suggested. Here on the right, you can see 2 out of 5 people don't wash their hands after using the restroom. Is your neighbor one of them? Are you? And we got permission from human subjects at UT to run a study on this. And so we hung the posters up in the lobby in CMA. A lot of times campaigns like this are hung on the mirror in restrooms. And so in a lot of ways, that means you're promoting hand hygiene to people who are already washing their hands. And so the poster in the middle was meant to be hung up in the CMA lobby, and the poster on the right was hung up in all the restrooms and above urinals in the men's room. People actually lie about their hand hygiene behavior, even on anonymous online surveys. And so the way to study this was 2 graduate students sort of hid inside bathroom stalls and did 30 hours of observational research, 10 hours at baseline, 10 hours at week 2, and 10 hours at week 4, to see how this campaign shifted behavior. We were excited for public health reasons that UT students were already at sort of a 9 out of 10 compliance rate at baseline, but this campaign still got more people washing their hands and more people using soap. So it did move people kind of towards better hand hygiene. And I was talking about this project at a conference on campus hosted by McCombs. And someone came up and said, hey, would you be interested in doing something like this at a hospital? And we were excited. I was excited about the opportunity to kind of look at hand hygiene in a new context. And, in the advertising sequence, we always teach people you have to work through tons and tons of iterations of logos and headlines and messages. And in our health comm work, we always want to start with good research. And so we both did key informant interviews with a lot of folks who worked at the hospital to better understand what do they think about hand hygiene, what are barriers, what are the reasons they kind of engage in hand hygiene. And then we started iterating through different messages and icons. And so here you can see as we started thinking about what a hospital campaign looks like, we started just iterating through lots of different versions of bubbles and soap and hands and, taking time. One of the things we really heard was that sort of there's 3 reasons people engage in hand hygiene in a hospital. And I think right now you could probably think of them much more easily than we might have at the time. And it's both to protect themselves as healthcare providers working in a hospital. It was to protect their patients. And then they also talked about protecting the people at home. So whatever we did was going to have to capture sort of those 3 reasons for engaging in hand hygiene. Our partner at the time was also really excited about Ignaz Semmelweis. And so he's the public health kind of pioneer who was the one who realized that hand hygiene was how you could prevent hospital-based disease transmission and bad outcomes as a result. And he has this super awesome mustache. And she was pretty adamant that we should try and figure out a way to work that into our campaign. And so we dutifully, started to think about, could we put that mustache on a little soap bubble? Just different ways of using that. And in a little bit of early kind of pilot research, it was becoming clear that not many people really knew who Ignaz Semmelweis was. They really didn't know he had a great mustache. And so this wasn't going to be the direction we went, but it was pretty fun. And then about 2 weeks ago, he actually was the subject of a Google Doodle. I went to search for something that day. I was like, oh my gosh, I know exactly who that is because of this hand hygiene, campaign project from 7 years ago. And so we worked through a lot of different versions and eventually landed in this idea of take time, save lives, clean hands, protect. And you can see this was sort of the brief or the strategy document we came up with that sort of explained the overall goals of the campaign, why we were taking the approach we were. You can see in the middle down there, it says, thank you for washing your hands before you leave this room. And that really comes from an insight we learned that some of the providers were saying that they knew they should engage in hand hygiene before they left a patient's room, but they were worried about hurting their patient's feelings. Like, oh my goodness, my physician or my nurse thinks I'm so sick they have to wash their hands before they leave the room. And so sometimes they would talk about leaving the room and then washing their hands. And so they would not do what they knew they were supposed to do in service of saving their patients' feelings. And so we created that sign to be hung up inside patients' doors, both as a reminder to providers of what they were supposed to do, but also giving them permission to do it because now they know that their patients know that's what they're supposed to do. It's not because of them as a patient. And so we actually studied this campaign in a couple of different hospitals, and it was effective in getting nurses to change their behavior and engage in hand hygiene more according to the proper protocols. So every time we would publish on this project, I would get emails from different hospitals asking for the materials. So last spring, our Center for Health Communication Steering Committee, which includes faculty from both the College of Communication and the medical school, as well as student representatives, and our staff team had a conversation like, what do we want to do with this? Like, it's clearly a thing that people are interested in. And this was a year ago. And our team was really adamant that we should make it available online for free for anyone who might want to use it. And so we put the materials online and have been promoting via social media. And actually, the Texas Department of State Health Services wanted to adopt and co-brand the materials for all their facilities, which is really exciting. We were excited about this even a year ago when it happened because it was a way we felt like our HealthComm research, which began just because of a class project really, was a thing out in the world helping improve public health. You know, the last couple of months have really made hand hygiene particularly important. And so we've now continued to push this out in the world. But I think it really highlights for us why health communication research in general is so important, because you never know what messages or materials are going to be helpful in the midst of something like what we're going through right now. So to talk a little bit about COVID-19, I feel nervous about this entire section, partly because we're still in a lot of ways in the early days of this. And I don't want to go too far talking about what we're doing or what we've learned, because I think there's a lot of learning we're still going to have to do. But what I want to do is explain a little bit kind of what the Center for Health Communication has been doing, and more broadly, I think what we might be thinking about for next steps. So when it was the Friday before spring break, and we got the email from the university that we weren't going to be coming back to campus and classes were going to go online. And I started getting questions from different folks on campus or system asking what our center could do. And I was pretty sure the answer wasn't going to be our own team creating a lot of materials related to COVID-19. Our team seldom includes the experts on a particular health issue. Like, we build teams with the right experts in communication and a particular health issue with partners from across the university. And so, especially with something like COVID-19, where what we know is changing so quickly, we didn't feel like it was the best service we could provide to produce a lot of materials. What we thought we could do is actually help curate and highlight really good materials that were being developed and disseminated around the country, and highlighting why we like the ones that we liked. And so as 50 states and the federal government and who knows how many counties and cities all start creating materials about physical distancing, someone's going to do that best. And how can we help people find and use the best things that we can find? And so as an example, we have an entire thread on the Center for Health Communication Twitter page, which I'll have a link to it afterwards, where we started collecting all these materials. And I think the very first one we added was this ad or poster from Baltimore City Health Department. And as an example, it shows these three guys here, and we liked it because, you can see this guy on the right, and it says, has an undiagnosed heart condition. Like, early news about COVID was talking about people who were older being more at risk. And this material uses something we know from lots of health communication research, that like one of the ways you can make a message more impactful is to sort of help people see their actual susceptibility to a particular health risk. And so there could be young people who have undiagnosed heart conditions or different things that are risk factors they don't even know about. And we want them to know that so they can understand why it's important to follow public health recommendations. This out of Seattle and King County Public Health. This viruses don't discriminate, and neither should we. It's important that stigma is not going to fight coronavirus, but sharing good information can. Was just an important thing I think that we all felt should be part of the conversation, that, this is not the moment to discriminate for any reason. Like, we're all in this together. And that's the thing that's going to help everyone contribute in the ways they can to the response. And the third example here comes from the World Health Organization. And in this case, it was about smoking. And, early reports were that people who have pre-existing lung conditions might be more at risk. And so this wasn't just saying, smoking can increase your chances of getting COVID-19. It really helpfully explained why. Because you could imagine someone who's smoking, who already knows that smoking is not great for them, then hearing like, oh, one more thing about why smoking is not good for me. Like, this is really important to explain sort of the details of why. So it's not just one more thing to potentially brush off. I'll show one more example. And part of the reason we, as a center, thought this was something we could do and help with was if we could highlight really good materials. There's probably some local health department in some state that has the best physical distancing poster in the country, and not many people know about it and no one's using it. We really wanted to try and help be more efficient in the creation of materials rather than everyone creating their own. And what that means is when you find a really good one, you should be able to take it, adapt it, and use it. And so we found this campaign from Washington, D.C. that was about pregnancy and coronavirus. And the recommendations here, washing your hands, staying hydrated, this is pretty much what you would tell anyone. There's very little here that's specific to being pregnant. But we know, again, from lots of health communication research, that a targeted message, women who are pregnant and expecting, is going to work better than something that's more general. And so our center for several years now has been doing work on a mobile app called Father's Playbook that's designed to get dads involved in prenatal health. And so we saw this, we're like, oh my goodness, like this is exactly a thing that we should be getting out, not just to women who are pregnant and expecting, but also to expectant dads in the world. And so we took their exact kind of content, put it into kind of the style and the approach that we're taking with this Father's Playbook application, and put it back in the world. There's a lot of health issues where we tend to focus on the target audience without realizing other kind of caregivers, supporters, parents, a lot of folks. And the ability to customize this means we, with the Father's Playbook app, were able to get out an important message to expectant dads without doing all this early legwork. It's a more efficient way of doing this. And so we created that thread to help spread good stuff. So hopefully more people can be more efficient spreading good COVID-related messages. When we, as I mentioned, it's a little hard to think about what we've learned because we're still in the middle of this. But one thing that's really clear is there's a lot of knowledge about how to respond in a crisis or emergency situation that already existed before this was happening. The CDC has a crisis and emergency risk communication manual, a lot of the parts of which haven't been updated since 2018, 2019. And that's because we have the playbook for this. And so the reason to have something like that ahead of time is so we know the best ways to think about audiences and the way people, like the psychology of a risk and emergency situation, to build more effective messages and not have to test and learn everything on the fly when we're trying to manage way too many other things at the same time. I don't think there's a really great, certainly national way to do what we're doing with that one particular Twitter thread. And so we think there's probably a big opportunity going forward to think about systems that could help rapidly kind of develop, test, and disseminate effective health messages and materials. And the last thing is something that we think about a lot, but others who come to work with us don't always think about right away, I don't think. And it's that I love health communication. Like, we run an entire center dedicated to it, but communication is not the answer to every problem. And understanding that sometimes it's a policy decision and not just a better message that's going to lead to the outcome we're hoping for is really important. In our own work, we think a lot about what are things where communication can make a difference in helping people make healthier choices or, lead healthier lives or contribute to public health. But sometimes communication is just not the answer. And so as we go forward after this, one of my hopes is that, maybe we better recognize the spots where it's a policy solution that's needed and not just a communication solution. Our center gets to do work across a lot of health issues. I think that's the thing that makes health communication the most fun for me. In addition to hand hygiene and getting dads involved in prenatal health, we're part of the state's response to the opioid epidemic, and we help develop messages for UT system around tobacco control. And one of the things that means is that we might learn a lesson in one health context or one population that then has utility across others. And so it's one of the things that I think is a real strength of our center is we're sort of a mile wide and a foot deep. And we get to rely on both our extremely talented center staff team, but also the expertise of faculty and grad students across campus from a lot of different colleges and departments. So it's been really great to share with you. I feel like 25 minutes of content is about the right amount for an online lecture like this. You can see at the bottom here, kind of contact information for me or our center if you're interested and want to learn more. And what I was going to do is take a quick look at one or two of the questions that were submitted before the talk while I wait to see if the Moody team here emails me any questions that came up during the talk. So one of the questions that came in before the talk was, what are the most helpful ways for local media to aid healthcare organizations after new cases have declined? And this was a really interesting one, partly because Talia Stroud, who will be giving the next Moody mini-series, like her work is particularly on media engagement. And so she's gonna be talking a lot about this. And so I wanna both plug her talk, because I think she's gonna talk about this more next week. But it's really top of mind for me thinking about what local media can do, because if all you do is pay attention to national media, it's very hard to keep up with what's happening locally. I was listening to NPR yesterday, and there was a story about the protests in Michigan. And one of the things that in the conversation they were talking about is if you're in Lansing, Michigan, you might not really be seeing the impact of COVID-19 very much, because something like 80% of the cases are in Detroit and Southeast Michigan. And so I think to answer this question, part of it is local media is really crucial to understand what's happening in for right here in Central Texas, and how does that play into kind of the Texas response and the regional response, the national response. Like, it's impossible for national media to do that working its way down. And so I think that that's one of the roles that local media can play just generally right now, is making sure people have this complementary information about what's happening locally in addition to what's happening nationally. One of the other questions that I got here was sort of a request to talk about outreach with disadvantaged communities. I'm really fortunate here at UT. I'm part of a group called Whole Communities, Whole Health, which is part of a Bridging Barriers Research Grand Challenge the university is running. And when COVID-19 started hitting, we were thinking a lot about how that project can help get important health information to our community partners. And we can't just rely on, follow our Twitter, follow our Twitter page, or follow Facebook, or follow whatever. Lots of people don't have great broadband access or internet access at all. And so it's really shown the value of several years of working closely with community partners, because when we were thinking about how we could get health information to a lot of audiences, someone on the team knew that, well, the local schools are still running bus routes to deliver food to kids who need it. Well, now those bus routes are basically media channels that we can use to get important health information to people who might benefit from it. And so I think that part of this question is the people working in public health having to get a little bit more creative to think about how we can not just rely on reaching sort of high information seeking, high access folks, but how we can reach people who don't have that kind of easy access at their fingertips. Another question we got here was, what are your thoughts on COVID-19 communication burnout? And it seems like we might run the risk of too much COVID all the time. We're not talking about other health issues. And are people just going to tune us out? And there's two things I have to say to that. And one is, that's really accurate. I think people are overwhelmed. It's tiring. People are tired from living their lives right now. And then the news being nothing but that all the time is just even more exhausting. But the other part of that, I think, is if you are a high information seeker or you work in media or you work in communication fields, you often might be consuming a lot more of this than the average person. One of the things that I think makes the Center for Health Communication most successful in its work is that because we don't do all of our work in a particular health issue, we can often bring the perspective of how kind of a normal person thinks about things like um, a particular health issue. Like if all you do is think about, promoting oral health, you don't think about that like normal people do. And so I think recognizing that the average person probably isn't consuming news media and stories about COVID-19 24/7 is also really important. They might just turn on the news once a day, in which case we have to make sure the information is there when they might encounter it. So I think it's a really tricky balance to achieve. We don't want to overwhelm people. We don't want them to tune out. And offering things they can do to take control of their own health. There's a lot of health com research that agency matters. Giving people things they can control matters a lot. And so framing our stories and our messages and our content in ways that can help them kind of help people take control of things they can is really important. And the last question here, I think I'll take real quick, is, and I like this one a lot. It's when physicians and scientists are too busy treating and researching, who will represent their voice in a cluttered communication space? I really like this because I consume a lot of media, and I think it's probably just some of the people I follow online. It's been really exciting watching healthcare providers and scientists who are doing a lot of work right now. Like people are stepping up to be the voice of their professions and fields and talk about what's going on, what's important to them, what it's like to be a nurse right now working in a ER setting, for example. And I think any of us can play a role helping amplify those voices. And so that's one of the benefits of social media right now. And I think for folks from the College of Communication who understand how communication works in a way that's probably advanced compared to most people, I think probably anyone on this call right now has a role to play helping amplify the stories of those scientists, of those frontline healthcare workers to help people hear what they have to say. And I think that's, again, one of the things that makes our center work really well is we work with people who are surgeons and study opioids and do a lot of really remarkable health and science research. And it's when combining those folks with the expertise that exists on the Moody College of Communication side of our center with faculty and students that the real magic happens. Like everyone gets to be really good at the thing they're good at. And the end result is better messages that can really help people lead healthier lives. So again, on behalf of the college, I really want to say thank you all for coming today. This has been a real exciting opportunity to share a little bit of what our center is doing. I think that there's great research we know happening around campus right now related to kind of the health communication of COVID-19. And in the coming weeks and months, it's going to be getting out in the world and helping people better understand kind of the communication challenges and opportunities that something like this presents. So it was exciting to be the lead in this mini series. There's a lot of great speakers who are coming up next. So I hope you can all stay tuned and learn a lot. And if you're interested in health communication in particular, please reach out. We'd really appreciate it. I could talk about this all day, but I think 35 minutes is probably pretty good when the whole world is zoomed out right now. So thank you for being here today. It was really great to be with y'all. Thank you.